Hi, my name is Matt Smith. I'm the HCA instructor. And my idea for this video was to combine hearing and vision into one little package that will help you to get a better understanding of how HCA skills are done. So there's a lot of visuals, you're going to have text, you're going to have images, but I'm also going to put some audio to it. I'm going to be doing some commentary added to that. Mainly what we're going to cover is what supplies you need, but I'm also going to do kind of an outline of how the skills should be done as well. So here we go. So some of the topics I'm going to be talking about are going to be guiding principles, core fundamentals, supplies, obviously, and then tips and tricks. So let's get started. The guiding principles are things like safety, infection control, privacy, excellence, and the wind up and the wind down. So this is kind of the preparing the skill, knock the skill out of the park like a pro, and then wind it down and put everything away. So those are kind of our guiding principles as we go through everything. Core fundamentals. This is the primary focus of this video. So core fundamentals would include things like breaking the skills into different categories, right? So we have water skills, we have transfer skills, we have recorded skills, and we have technical skills. So water skill would be like, bed bath, pericare, things like that. Transfer skills, assist from bed to wheelchair, assist to ambulate. Recorded skills would be something where you have a weight or a blood pressure or pulse respiration, something you have to have a number, so you have to record a number. And then technical skills. Technical skills is kind of a grab bag, so you have to remember technical things like you wash your hands for 20 seconds, you record a radio pulse for a minute, things like that. Just little detail things that you have to remember. You just have to learn them. Introduction. Okay, in the book we have what's called SWIPES, and that stands for supplies, wash, identify, privacy, explain, and scan. So this is supposed to help you with your introduction. My suggestion is to have a script. So a script would look something like this. Hi, my name's Matt. I'm going to be your HCA today. We're going to be assisting you to ambulate. Give me a minute while I wash my hands, put on my gloves, and provide you with some privacy. And then we're going to scan the room. Now, scanning is something we do all the time, okay? Think of yourself as the Terminator. What did the Terminator do? He scanned. So moving on with more core fundamentals, we're going to talk about water skills. So some of the core fundamental things you want to remember about water skills is to always test the water. You don't want to go throwing cold water on somebody, do you? You don't want to burn them, do you? The answer is no. So you always test the water. That's a safety issue. Now you want to wipe front to back when you're doing pericare. So the back can take it, but the front can't. So you always wipe front to back. Rotate the cloth. So you want to rotate the cloth, wiping front to back, using a different area of the cloth for each stroke. And always remember to wash, rinse, and to pat dry. And always remember to empty, rinse, dry, and put the basin away when you're done. That's the unwind. So moving on, we're just going to handle each one of these skills one at a time. We're going to talk about a bed bath. You are going to need 4 washcloths, 2 towels, soap, water basin, laundry basket, and a waste paper basket. Now the idea behind a bed bath is that you're going to clean them. You're going to wash, rinse, and dry their entire body. You begin by giving your introduction. Hi, my name's Matt. We're going to be doing a bed bath today. Please give me a minute while I wash my hands, put on my gloves, provide you with some privacy. You scan the room, make sure everything's okay, make sure you have your supplies, you're ready to go. So now you engage the client. You say, hey, could you test the water for me? How does that feel? Fabulous, thank you. So the first thing I'm going to do is I'm going to get my washcloth wet. I'm going to use no soap. I'm going to do the eyes, inner aspect, outer aspect, using a different area of the cloth for each stroke. Then I'm going to do the face, the ears, and the neck. Now I'm going to proceed with the body. So I'm going to take the arm, I'm going to put a towel underneath the arm, and then I'm going to wash, rinse, pat dry the arm. Take the hand, put it in the water basin, wash, rinse, pat dry the hand. Now you repeat that procedure for both legs and the other arm. Then you finish with the chest, and then you gently roll them over and do the back. And that's a bed bath. Next, we will do peri-care. Peri-care is 4 washcloths, 2 towels, soap, a water basin, laundry basket, and a waste paper basket. Does that look familiar? It should, because you just used it. So peri-care is one of those skills where you want to use minimal exposure and do your introduction. Hi, my name's Matt. We're going to be doing some peri-care today. Please give me a moment while I wash my hands, put on my gloves, provide you with some privacy. Now I'm going to scan the room, make sure everything is in order. Remember, scanning is an ongoing process. You're constantly scanning, constantly looking for everything that has to do with your skill, the steps, the elements, the supplies. It's kind of a mindset. So you begin by testing the water. Water's fine. Now we're going to just gently expose the middle area of the resident, and then we're going to dip our washcloth in the water, hit it with soap, get it nice and soapy. We're going to wash, wiping front to back. We're going to rinse, wiping front to back. Then we're going to pat dry. Now we're going to ask our resident to turn. We're going to wash, rinse, pat dry the back. Then we're going to unwind the skill. We're going to put away our dirty linen in the laundry. And we are going to empty, rinse, dry our basin and put that away. And put the soap away. Just kind of unwind, put everything away. And then we'll be done with the skill. So supplies for catheter care. Guess what? 4 washcloths, 2 towels, soap, water basin, laundry basket, waste basket, and you got it. Gotta add a chuck pad to this one, folks. So when you're doing the catheter care, it's just like peri-care. It's all the same setup, but you need to put a pad underneath the catheter tubing when you do the skill. Then you hold the catheter right up close to the body, and you do 1, 2, 3 strokes using a different area of the cloth, and then you grab your rinse cloth, 1, 2, 3, rinse, and then you pat dry. And there you have catheter care. So supplies for mouth care would be clothing protector, toothbrush, toothpaste, an emesis basin, and a glass of water. So you're brushing teeth, you guys. That's what you're doing. We all do it all the time. So you got to get your skill. You got to get your supplies together. Do your introduction. Hi, my name's Matt. We're going to be doing mouth care today. Give me a minute while I wash my hands, put on my gloves, provide you with some privacy, scan the room. I'm not going to be doing that introduction anymore. So get used to saying it. Well, who knows? Maybe I'll slip and do it once more because it's such a habit. We'll see. The thing to remember about mouth care is you put on the clothing protector, you moisten the toothbrush, you put the toothpaste on it, and you simply brush their teeth. And I would say, okay, I'm doing upper right, upper left, upper center, rear, and then, lower right, lower center, and just kind of talk your way through it. And then say, okay, let's do the tongue. If you don't do the tongue, then you're not doing mouth care. So make sure to include the tongue. So there's your supplies and there's your steps. So the supplies for nail care, you're going to need an emesis basin with water, an orange stick. You're going to need a washcloth and an emery board. The idea here is you take the basin, you put their fingers in it for a few seconds, let it soak, and then you dry it off. And then what you want to do is you want to take the orange stick and you clean under the nail, and then you wipe it off, and then you file. Take the orange stick, clean, wipe, file. Orange stick, you're cleaning the orange stick off on the paper towel. That's what you're doing. So you clean under the nail, wipe the orange stick off on the washcloth. And then you file. And that's what you do. And then you just dip that in. You rinse off the powdery residue. And that's what it takes to do nail care. Okay, so now I want to talk about foot care. The supplies we're going to need are going to be a basin, an orange stick, a washcloth, an emery board, and lotion. So the process for foot care is very similar to nail care. You're going to take the foot, you're going to place it in the basin. You're going to take it out, you're going to wash, rinse, pat, dry the foot. Then you're going to clean the nail. So you're going to use the emery board, clean the nail, and then wipe the nail on the washcloth, and then file it. Then you're going to clean the next. You're going to wipe the emery board on the washcloth, and you're going to file it, and you're just going to continue that process till everything's done. Now what you want to do is take a little bit of lotion and put it in your hands and just cover it all over rub it into the foot. But you do not want to put any lotion between the toes. So make sure there is no lotion between the toes. There you have foot care. So Now we want to talk about some transfer skills. So transfer skills, remember non-skid shoes, remember feet flat, and it's very important, 1, 2, 3, brace the knee, you are going to stand. You never want to say, I'm going to pick you up. Okay, you always want to say, you are going to stand up. So you plant the idea in their mind that they're going to have to stand, they're going to work with you. So let's talk about assist to walk. You're going to need a gait belt. You're going to need non-skid shoes. So the idea here is they're laying in bed. So you're going to go in, you're going to help them up. You're going to do your introduction. You're going to say, hey, can we get you up to walk today? You're going to put a hand on the hip, hand on the shoulder, turn them up and say, great. Now, could you scoot forward a little bit for me? Put your feet flat on the floor. So they're going to do that. You're going to say, I want to make sure you have non-skid shoes on before we get you up. Okay, you do. Now you can put on the gait belt. Get it nice and snug. You say, okay, 1, 2, 3, I'm going to brace the knee. Up we go. Once they're up, you simply turn them, walk them 12 feet, which is about 3 or 4 steps. Turn around, walk them back. Go ahead and sit them down in the chair. Now you can remove the gait belt, and you've completed that skill. So next we have bed to wheelchair. So you're going to need a gait belt. You're going to need a wheelchair and non-skid shoes. So this skill is very similar to assist to walk. The only difference is you put them in the wheelchair. So now you walk in, you sit them up, scoot forward, feet flat on the floor, non-skid shoes, gait belt. 1, 2, 3, brace the knee, up we go. So now instead of walking them, you simply pivot them over, say, could you back up until you feel the back of that wheelchair on your legs? Okay, great. Now go ahead, reach back, grab the handrails, and have a seat. All right, fabulous, good job. At this point, I'll take off the gait belt because they just sat down. They're not quite scooted all the way back, so there's still a little bit of room to get the gait belt off. So at this point, I will remove the gait belt. Now I'll say, go ahead and scoot back towards the back of the chair. Awesome, you nice and comfortable? They say yes. You say fabulous. Now we don't have to say fabulous. You can say whatever you want. So now we will fold in the footrests, put their feet on the footrests, and unlock the wheels, and they are ready to roll, literally. Reposition in bed. Now, this skill is all about body mechanics, but you're going to need 4 pillows as well. So they're lying in bed. You're going to go in there. They're going to have a pillow under their head. So you're going to need 3 more pillows, 4 in total. And you're going to just, do your introduction gently, ask them to maybe scoot over a little bit and then roll and reposition. And then you're going to readjust the head pillow because the head now is tilted. So readjust the head pillow. You're going to give them the Snuggie pillow under the arms, what I like to call it, the Snuggie pillow. And then put a pillow behind their back. Then put a pillow between the knee and the ankle. And that's what you need to do to reposition a client. So now we want to talk about recorded skills. Remember to write it down. You have to write down a recorded skill. You need paper and you need a pen. Okay? So let's talk about radio pulse. You're going to need a clock or a watch. You're going to need paper, and you're going to need a pen. And of course, you just do the pulse. You just do it for a full minute, and you count each pulse as you go, and then you write that down. Now we're going to talk about technical skills. So technical skills are just kind of terms, like I said, it's a grab bag. So remember 20 seconds for hand washing. Remember that when you're doing a TED hose, no twists, no wrinkles, and heel is correct. And always give them a choice. Like when you're feeding them or you're doing clothing, you give them a choice. What would you like to eat? What would you like to wear? Something like that. When you're doing meds, remember the 5 rights. Okay? And remember when you're doing dentures to line the sink with a towel and use tepid water, or what I like to just call lukewarm water. Okay, so let's talk about hand washing. The supplies you're going to need is going to be, of course, a hand washing station, but then you're going to need a waste paper basket as well. So the idea with hand washing is you wash your hands for 20 seconds. Now you turn on the water, you rinse your hands, you get soap. You get a lot of soap, lots and lots of soap, work up a really good lather. And it doesn't matter how you wash, but as long as you keep your fingertips pointed down, you'll be fine. And then do your wrists, do the fingertips, between the fingertips, and just do that for 20 seconds. Okay, so now you're done. Your hands are soapy. You just rinse them. Just rinse them under the water really nicely. Now they're all rinsed. Water's still running. You reach up, you grab a paper towel. You begin to dry. You throw that in the waste paper basket. You grab another paper towel. You begin to dry. You throw that in the waste paper basket. Now your hands are good and dry, but wait a minute. There's one more thing you need to do. You need to grab a clean paper towel and turn the water off with a clean paper towel. And that is hand washing. So supplies we're going to need: TED hose, You're going to need a stocking. You're going to need a TED hose stocking. Now, there's a lot of different techniques for putting on a TED hose. I'm not demonstrating skills right now. There's other videos for that. But you get the stocking. Just make sure it's right side out. Make sure the heel is in the correct place. Make sure there are no twists and no wrinkles. And I like to feel for them, and I like to visually inspect for them as well. So tactile, visual, no twists, no wrinkles, right side out. You'll nail that one. So supplies for denture care. You are going to need, of course, a denture and a cup. You are going to need denture paste, a denture brush, a barrier towel, and a nemesis basin. So you just clean the denture, you guys. It's not a big deal. So you go in, you do your introduction, you turn on the water, you gather your supplies. Make sure you use denture paste. Make sure you use a denture brush. And you just, get them wet and just clean them. Get them all nice and clean. And I like to put down a paper towel kind of as a barrier where I can set my basin and I can kind of set my my denture paste and whatever. So it's to put a towel down. This is kind of my style. But once you've washed it, you rinse everything out really good. Rinse off the brush, rinse off the cup. Don't forget to rinse off the lid. So you do the entire thing. And then you put a little water in there. You put the dentures in there. You shut it. You set it aside. Then you do the unwind. Okay. You unwind the skill. You empty, rinse, put away your basin. Put away the denture brush, denture cream. Put the washcloths in the waste paper basket. And you're ready to go. Awesome. So supplies for feeding, pretty simple. Clothing protector. You'll need hand towels. And you'll need a table settings with some food on it. And something to drink. So the idea here is to just feed somebody, but you want to converse with them. So you do your introduction, you sit down, you put on the clothing protector, you ask them, you say, what would you like to eat today? Looks like we have some fruit, some grains, some veggies, some protein, and we have some water and some milk. What would you like first? They'll say, well, I would like to try my vegetables. Okay, here are some vegetables. They will eat that. Now what would you like? Well, I think I'll have my protein. I think I'll have a little chicken. Okay, great. Here's a little chicken. Now you offer them something to drink. So you'd say, here, have a glass of water. So they drink that. Then you repeat that process. What would you like? Here you go. What would you like? Here you go. Here is some water. That is the process for feeding. When you're all done, of course, you're going to take the hand wipes, help them clean their hands, clean their mouth, take off the clothing protector, put that in the dirty laundry basket, gather up all your supplies, put them away, and that's the skill. Supplies for assisting to dress, pretty simple. 2 shirts. Once again, you do your introduction, and then you'll say, which shirt would you like to wear? Would you like the striped or the solid shirt? They'll say, well, I'll take the striped shirt. You say, perfect. Now, the thing to remember is they may have a gown on. So if you're taking a gown off, you start with the good arm. Okay, so you take it off because the good arm can help, right? The affected arm cannot help. So you start with the good arm. You take that off, and then you can get the shirt off. Now, you're putting on a new shirt. You start with the affected arm. So you're going to put the shirt on, square it up as good as you can, get the other arm through, pull it over, get them all nice and comfortable. Make sure the buttons are in a perfect line. Make sure the shoulders are in the right place. And then inspect the rest of their clothing. How do their pants look? How do their shoes look? Everything tied, everything look good. And then you will have completed the skill. So range of motion, knee and ankle, you need gloves. Not demonstrating skills, but the things to remember are gently move the limbs through the range of motion. And I like to say, hey, let me know if you feel any pain. Same thing with shoulder. Let me know if you feel any pain. The only thing you're going to need are gloves. So med assist. Once again, you're going to need gloves. Things to remember are the 5 rights. Right route, right patient, right dose, right time, right route. So make sure, and they're all on the label. The 5 rights, what they're telling you is to read the label. So you have your first pairing. So you have the order. You have a bunch of pill bottles over here. Now what you have to do is match the order with the pill bottles. So get the name, get the medication, look at the dose, look at the route, look at the time, look at everything. And then once you get that matched up, you can open it. Now guess what? You do it again. You verify the 5 rights after you opened it. So that's twice. So now you can give them a glass of water, give them medication, they'll take it, make sure they swallowed it. So did you swallow that? Good, okay. Now you're going to unwind the skill. You're going to put the medication away, but you want to verify the 5 rights one more time. So you verify the 5 rights 3 times total in the initial pairing, after you open it, and before you put it away. Okay, so supplies for assist with bedpan. You're going to need a bedpan. You're going to need toilet paper. You're going to need hand towels. This is a pretty basic skill. Thing to remember is that when you remove or apply the bedpan, the bed has to be level. That's what you have to remember. And when they're using it, the bed has to be up. So you walk in, you do your introduction. If the head of the bed is raised, you lower it. And if it's already lowered, you don't have to do anything. Just kind of remember that. It's kind of one of those things, kind of a technicality that I think helps keep the skill into perspective. So let's say the head of the bed is up, you lower it. You just say, hey, I need to place this bedpan, and make sure the wide area of the bedpan is lined up with the shoulders. That's the direction, okay? So you correctly place the bedpan. Now you can raise the head of the bed and give them the wet wipes and the toilet paper. Now you can wash your hands, or take off your gloves, wash your hands, leave the room. Now you come back in, you wash your hands, you glove up, and you say, hey, did everything go all right? Do you need help cleaning up? Any pericare? They say no. You say, okay, great. Now you will lower the head of the bed. You will remove the bedpan. You will rinse the bedpan and dump it in the toilet. And you do not wipe this. Earlier skills I've mentioned, empty, rinse, wipe the basin. Empty, rinse, wipe the basin. You do not empty, rinse, wipe the bedpan. You empty it, you rinse it, you dump it in the toilet, and then it goes to the designated dirty area, and you're done with it. At this point now, you can go back, you can raise the head of the bed for them, and you can gather up the wet wipes, the toilet paper, kind of unwind the skill, put everything away, and that's how you do a bedpan. So that concludes my review. I hope you enjoyed it. I hope you found it helpful. A few final thoughts. Keep studying until test day, all right? Don't take a break. Just keep studying. That doesn't mean every day or anything like that. It means just once or twice a week, 3 times a week, whatever. Take 20 minutes, take a half hour just to sit down, read through your skills list. Just read through it, and review. Just review the textbook. Okay, so you want to read through your skills, review your text, review some more until you're absolutely sick of it. And have a great time. It's fun. It's fun to do things correctly. It's fun to do things safely, and it keeps a high quality, high standard that we all want. That high standard of excellence and care that we want to do. And remember what I always say is that caregivers are the salt of the earth. So go forth and give care. Thanks.